Thank you, Dr. Gopal. Can I light down, please? Thank you. I'd like to thank the members of APAO and especially Congress President Professor Azad and the organizing committee. It is my great privilege to present here today. I'd like to talk about the morphologic changes on retina and choroid after hypochondroplasia. Sorry. Okay. Vitreoretinal surgery has a history of 100 years. Pars-plana vitrectomy was introduced by Dr. McNamara in 1971. Nowadays, rapid and precise surgery is made possible thanks to small gauge vitrectomy, high-speed cutter, stable fluidics, and filtered endo-illuminators. However, post-vitrectomy retinal damage are still being reported. I'm sure that many of you have you seen your patient optic disc growing pale over time after vitrectomy. This is a case of 45-year-old male who underwent vitrectomy for macular hole. His optic disc turned pale. RNL defects were detected at 12 months after vitrectomy. This is another case of a 63-year-old male who underwent vitrectomy for macular hole. Multiple dot-shaped retinal thinning was found on SDOCT along the RNFL defects at 6 months after surgery. There are many causes that could result in retinal damage by vitrectomy. Retinal toxicity is mainly classified in two categories. One is light-induced retinal injury, which means phototoxicity. The other is chemical injury. ICG is the main concern in chemical toxicity. Air fluid exchange can leave visual field defect in the inferior temporal area, just opposite the infusion site. However, there are reports on nasal field defects. And there are reports on choroidal damage that may occur after vitrectomy. Tamai demonstrated that choroidal blood flow changed depending on the temperature of the irrigation fluid. Vertigono reported that choroidal blood flow decreased after vitrectomy. In order to detect the morphologic change on the retina and choroid after vitrectomy, I thought of conducting research as follows. 1. RNFL changes. 2. Appearance of DONFL. 3. Morphologic change of GCIPL. 4. Subfoveal choroidal thickness changes. As mentioned earlier, some patients' optic disc became pale after vitrectomy, so we tried to evaluate the RNFL changes after vitrectomy. I made a plan for a retrospective study on 44 patients who received vitrectomy, 19 patients with ELM, 12 patients with macular hole, and 13 patients with vitreous hemorrhage. Preoperative and postoperative RNFL changes measured by SDOCT were analyzed. This is a case of 82-year-old female who was given vitrectomy for ELM. Definite RNFL thickness in the superior and inferior quadrant decreased after surgery. This graph shows postoperative RNF thickness changes by quadrant. When postoperative eyes and fellow eyes are compared, postoperative eye shows significant decrease and superior and inferior quadrant at 6 months. Each graph shows postoperative RNFL changes according to the diseases. Macular hole showed significant decrease in the inferior quadrant. What would make the superior-inferior quadrants vulnerable? It has been assumed that this might be watershed area in the junction of blood supply. The lamina curvosa shows the pore in the superior temporal and inferior temporal area are larger. Larger pore may make these lesions more vulnerable to compression. During the study, we found localized loss of retinal layer. This is a dissociate optic fiber layer. I planned a retrospective study involving 52 eyes of macular hole surgery, preoperative, postoperative, fundus photography, cross-sectional image, and retinal surface image were analyzed. 62-year-old female patient received vitrectomy macular hole. After surgery, retinal surface CT scan image showed the temporal extent of the lesion. The area of defects tended to grow along the stria over time. This graph shows postoperative DONFL appearance according to the examination. The cross-sectional and retinal surface area images show the significant high DONFL appearance. At 6 months, DONFL detected increased up to 90%. The cross-sectional B-scan images were classified into low dimple, RNL dimple, IPL dimple, according to the depth of defects in the retina. This graph shows postoperative dimple appearance according to the follow-up period. There were 29% with the RNL dimple and 14% with the IPL dimple at 1 month. At 6 months, the RNL dimples increased by 60% and the IPL dimples increased by 31%. Now, the macular ganglion cell layer can determine the impact of vitrectomy on the inner retina. Ganglion cell analysis of serous OCT can measure the thickness of the superior ganglion cell and inner proximal layer, namely GCIPL thickness in the macular lesion. This retrospective study was planned involving macular hole surgery and postoperative GCIPL thickness was compared. This is a case of 61-year-old females who received vitrectomy for macular hole. The GCIPL thickness continued to decrease from 1 to 6 months after surgery, especially the temporal side decreased. Blue color. This graph shows postoperative GCIPL thickness changes. The thickness decreased significantly at 1 month and 6 months after surgery. Preoperative GCIPL thickness shows no significant difference between nasal and temporal sectors. However, the temporal sector significantly decreased after surgery. In addition, GCIPL thickness in peeling group decreased significantly. Next is a study on the subfoveal choroidal thickness changes. The choroidal thickness might be supposed to reveal a choroidal circulation. A retrospective study was planned on 12 eyes with ELM, 13 eyes with macular hole. Preoperative and postoperative choroidal thickness were analyzed. This is a case of 58-year-old female patient who got vitrectomy for macular hole. Before surgery, subfoveal thickness was 177 micron and it decreased to 138 micrometer at 12 months after surgery. This graph shows postoperative subfoveal choroidal thickness changes. The subfoveal choroidal thickness significantly decreased during 12 months, and there were no difference between ELM and macular hole. The four studies enabled us to identify morphological changes in the retina and choroid after vitrectomy. RNF thickness, DONFL appearance, GCIPL thickness changes, and subfoveal choroidal thickness changes. In conclusion, the RNF thickness in vitrectomized eyes declined during 6 months. In addition, the RNF thickness is reduced mainly in the superior and inferior quadrants and prominently in macro hole surgery. At 6 months after surgery, the incidence of DRNF increased up to 90%. There was 6% with the RNF dimple and 31% with IPL dimples. The GCRPL thickness in the IL and peeling group was reduced during 6 months. The GCRPL thickness in the temporal area was significantly thinner than in the nasal area. The subfoveal corridor thickness in the vitrectomized eyes decreased during 12 months. Thank you very much.